Hello, and welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today, I have Brittany Bond, Clinical Liaison with Caldwell Hospice, and Freda Cowan, who is an FNP, that's Family Nurse Practitioner.
Family Nurse Practitioner.
With Caldwell Hospice. Welcome, ladies.
Thank you.
Thank you for having us.
They are here today to talk with us about palliative care and summer weather. We know we have gone straight into summertime.
Mm-hmm.
Yes.
So first, let's start with palliative care. Some of our guests know what that is, but some don't. Tell us what palliative medicine is.
So palliative medicine is a specialized consult service. It is designed to provide palliative support for patients and or families. So let me back up and say palliative care. Palliative care is a Latin term which means to cloak, and a cloak also in our terms means to support, to provide comfort for patients and their families. So any chronic disease or serious illness is not just one that belongs to the patient. It is a whole family unit. So as in our service, we consult to provide emotional, spiritual, psychological, as well as clinical support. We work strongly with the community providers as well as other community services so that we can provide continuity of care. One of our strong points, of course, is advanced care planning. So we do a lot of advanced directives.
Okay, you said advanced care planning and advanced directives. For viewers who don't know, what does that mean?
Okay, Brittany?
Well, so advanced care planning and advanced directives are basically terms that describe the documents that you can complete to make your wishes known. So if you cannot speak for yourself and you have a medical emergency, you can have these documents to show what your wishes are, what you would like to happen. If you would like to have a feeding tube placed, if you would not like that, if you would like what kind of heroic measures, what kind of services you would like to be provided if you can't make your own decisions for medical care. It takes some of the burden off of your family when they're trying to make those decisions for you by having a roadmap of what your wishes are.
And with palliative care patients, that's very important because these patients, like you said, have chronic illnesses.
A lot of the patients have serious illnesses. We've sort of got away from the chronic term and went to more serious illness, which encompasses a large number of chronic illnesses and diseases. So as a result of that, decisions have to be made, and it's very important to make decisions. I always tell the patients it's better to make the decisions on the front end instead of the back end. And it's also important to give your loved ones, your family members, your connections, information regarding what you would and would not want. I always tell them it's good to make decisions when your lids are up and you're in your right mind. And they do the exact same thing. They start laughing.
Now, as summer approaches, some people living with serious illnesses, it's a little more difficult for them. What are some of those illnesses that you seem to see struggling a little bit during the warmer weather?
So warm weather or extremely cold weather, both of those affect serious illnesses. For example, patients who have lung issues or concerns, congestive heart failure, COPD or chronic obstructive pulmonary disease, any lung or heart conditions, they can easily be affected with the heat, whereby their body is unable to regulate the hot temperatures. As a result, they need to be cooled off, or they may not even know that they are extremely warm until they have what older adults would call a heat stroke or get too hot, you know.
Right.
So it's very important to have good understanding of what you need for that. And to stay cool and to hydrate. A lot of adults, particularly older adults, fail to hydrate. And hydration is not 4 ounces of water each morning either. It's more like 8 ounces of water. And the word was water.
Water.
Right.
Not coffee.
Water.
Yeah.
What tips do you provide when you go in and visit with these patients?
So in our palliative service, we do a wide array of visiting techniques. And with this new COVID pandemic that we're having, we tend to do some home visits if there is no indication that there has been exposure. Right. So we'll go in the homes at that point. And as a nurse practitioner or a clinician, we do inspection from the time we hit their driveway. So it's monitoring for safety, home safety. We monitor their ability to take their medications. Are they aware of their medications? We monitor the home for fire potential, for fall risk, so we want to know about throw rugs and things in the home. We work with the patient and or family regarding family dynamics, because any serious illness is not one that belongs to just the patient. It is indeed a family unit. So we want to know, how can we help you get through this? We also serve as I always say, let me be that individual that helps you walk along the trajectory, walk along the path of this serious illness. And it may be that I write a series of questions for the patient to ask their primary doctor. When you go, you tell him, I can't leave here until I get these answers. Either write them down or you need to call her.
Okay, that is an amazing service, because I know that advocating for yourself as a patient is crucial these days.
Difficult.
And it's really difficult when you have a serious illness. And a lot of our older adults may be a little bit fearful or hesitant, or what the doctor says is authority. And you're encouraging them to ask questions. Can you give me an example of a question you might ask for a patient with COPD, for example?
I'll give you a this week example.
Okay.
So I saw a patient this week, and they had COPD, chronic obstructive pulmonary disease, and they were really concerned about going out of town or having family members come in. I said, well, you know, we do have this pandemic going on. Well, I'm going to see the doctor tomorrow. What do I need to find out? I said, you need to make sure that, one, that you are negative, and also you want to make sure that you have all your immunizations. So immunizations being, is your flu vaccination up? What about, have you had your pneumonia vaccine? And are your labs appropriate, or is your immune system down, whereby it does not make it necessary for families to visit you? So we wrote those questions down. You find out about this, you find out, and either hand him that paper if you feel uncomfortable saying it, and tell him, you know, I must get these things answered. Or you just let them know, we've got to cover some things before I leave.
That is incredible. I know that when you go in to see a patient for the first visit, whether you go in or you do it through telehealth, which has become a thing, talk to me about how you see change in that patient as you work with them through palliative care.
So there again, our role is to support patients and families. We become friends with the patients and let them know our role is to walk you through this chronic disease. So when we first visit a patient in their home, we're welcomed into their home. Then we learn more about them. We learn more about their pets and their habits and what they like and what's important to them, so that, of course, we can complete some of their legal documents. We also make sure that the patient has all of their medications, and we get a relationship whereby they say, hey, if anything happens, I want you to call me. I mean, because we're in this thing together, and we will see you to the end of this thing. They'll sometimes say, Freda, will you be there always? Well, one thing about Freda has a team. So it's not just Freda, it is Caldwell Hospice and Palliative AIM program. So at any point where the patient needs more than me, more than Freda, then we can definitely enroll them into the bigger program. I always let them know that's a part of our whole program, but that's not our entire program.
And you mentioned you have a team. For a palliative care patient, is it just you, or?
No. Oh, no. Oh, no.
No. Tell me who's on your team for palliative care.
No. So palliative care is a consult service. So we consist of nurse practitioners and physicians. We also have a social worker and a chaplain, and we also have a wonderful liaison who assists with us. not only that, since we are a part of a larger group, if we need to access any other the services that hospice has, we can easily gain any of those services or support.
That's true. And as you were talking, I just thought about the grief support that hospice offers. So maybe you have a palliative care patient lose a loved one and you're that natural connection.
Absolutely, we can definitely connect.
So that is very exciting. And before we went on air, we were talking about a patient maybe having to be hospitalized, but they have a pet at home. Tell me that story again, just or that example.
So we have had palliative care patients with serious illness that are still seeking active therapy with their primary providers or their specialty providers. This particular patient had to be hospitalized related to their serious illness, but they also had several animals in their own home. Freda, I'm in the hospital. What am I going to do? What am I? Let's see. Brittany, this is Freda. We've got to do something with these animals because that's a concern. There again, that is that individual's support. And what are we going to do for that individual's support? Then Brittany would either find some rescue or try to locate some neighbors or friends, someone to support that, which gave the patient ease so that they could heal and return back home.
And I don't know which one of you will want to answer this question. Caldwell Hospice has been doing palliative care for a number of years in the community. How has that evolved over the years? I know Brittany has been there for a while.
Well, our program has become more, I would say, more comprehensive. Would you agree, Freda?
Definitely.
It was originally administered by our medical director and an RN, and since we looked at how to best meet the needs for the patients who have need of palliative care in this community, who are living with serious illness, and the model became more provider driven. So, that was an opportunity for them to have a higher level of clinical oversight in their home so that they could not only have, the support of their specialists that they go and see in their office, their primary care doctor that they see in their office, they also have a specialist who can come to their home and who can reach out to the rest of that team and say, this is what I'm seeing in this person's home environment, and these are the things that I'm recommending that we need to do for their care. And so the program has really evolved to be more driven that way, and then to still include the support of the psychosocial and the spiritual piece as well. So,
how does a person connect with palliative care?
Go ahead.
Okay. Anybody, it's very similar to, it's super easy. The same process that we use for anyone who needs the support of hospice care. You can simply call our office, and we can probably put the number on the screen at some point for the folks, and call our office and let them know that you're experiencing some trouble managing your serious illness, and we can take it from there and reach out to your primary doctor and get you underway, get you under care. So,
I will add, it's very important to call so that we can find out what program best suits your medical condition, your serious illness. And so it may be that you don't need much of palliative care. It may be that we're a good resource in order to get you other services. Or it may be that you need a lot of support, and then we can help structure that support that you need.
So a caller doesn't necessarily need to know what service they need.
I need help.
I need help. I like that. That's a really good way to put it. And palliative care, I know at one time, somebody called it hospice light, and I don't really think that's what it is anymore. You've really grown to be a support for people with serious illnesses.
Right. So hospice, by definition, is a program designed for patients who have a prognosis or a likelihood of death 6 months or less if the disease runs its normal course. That would be the definition of hospice. Palliative care is a consult service that can support any individual with serious illness from the start of the serious illness until they either no longer want our support or they no longer need our support. So we have patients that are in our program over 1,000 days, and patients that are in our program for a few days to a few weeks based on their need. I would like to mention that that cost, because that's always that is a major concern, and I usually get that out of the way fairly quickly for patients and families because that's a concern for us all. Palliative Care, or the AIM program, our program is paid through Medicare, Medicaid, and private insurance. And we also have some support that we can help the patients who don't have any of those accesses. We do sliding scale fees, and I always say, if you need the service, let's get it. I do a lot of the clinical, so I don't do the financial piece, but if you need the service, you can well believe we're going to provide that service for you. We're going to help you.
Talk to me about where your patients live. Are they all in their homes, or?
So we have the majority of our patients are homes, in their own private homes, and we have patients that are in assisted living facilities. We have patients that are in skilled nursing facilities. We have patients that are in other areas for living. We see patients that are in shelters. We have seen patients that were homeless. We have served patients in the Walmart parking lot if we needed to visit them. We see patients, we're going to be there for you. So wherever we can meet you is a good place. If it appears to be a little less safe, we will choose more public places to provide you with some support. But
so really, it's palliative care wherever you are.
Wherever you are.
Brittany, I know in your role, you spend some time working with providers.
I do.
How have providers opened up? And when we say providers, we're talking about physicians, nurse practitioners, PAs.
Yes, your family doctor.
Your family doctor. How have their opinions of palliative care changed since you've been in your role?
Well, I think that the feedback that I receive is that palliative care is seen as a way to have an extra set of eyes and ears on your patient in their home, to work collaboratively to make sure that their needs are met. Palliative care is also a service that helps keep people from having to readmit to the hospital, which is, a blessing for that patient and for the family as well. So those two factors, having that additional, like we were saying, that clinical oversight in the home, and having this service that helps prevent a readmission to the hospital, that can, potentially be prevented by just having some additional support, some additional education in the home. And most of our doctors right now, if you have an appointment, you have about 15 minutes, and they are doing their best to put as much information and gather as much information to provide the best care that they can possibly provide for their patients. But then when one of our palliative care providers is able to go out and spend an hour assessing the patient, providing education, making that yellow legal pad list of questions to make sure that that patient's equipped to go to that appointment, ready to go, and can make the most of their time with their doctor as well. So I see that all those things have been mentioned as benefits from the providers who are working with our palliative care nurse practitioners and physicians. So.
How many palliative care nurse practitioners do you have at this point on staff?
We're 9. I think we have 9 nurse practitioners and 2 full-time physicians.
Yes. That's amazing. And you serve people living in just Caldwell County?
Oh, definitely not.
Okay, tell me where you serve.
We are Caldwell County, a small portion of bordering Burke County. We border Catawba County. We're bordering everywhere. Wilkes County. We go up into high country. So we have high country and low country. So high country is Watauga, West Jefferson,
Watauga, Ashe,
and Avery County.
So you really are expanding your service and providing for a wide range of people.
Well, and Paige, you and I have talked about this before, but I'll say for the guests that one of the big reasons that we were invited by Appalachian Regional Health System to come and serve in the High Country was because of our ability to provide palliative care, because they were underserved in those communities, both for hospice care needs for their residents, but also for palliative care, for management of serious illness and that additional support. So that was a major factor in the decision of our organization to move to the High Country and to provide some service up there. So.
Because it was a big, and it had to be a big step because you had, there's a lot of years, and hospice is well rooted here in Caldwell County.
Yes.
And I think Brittany and I have talked about this. When I think of hospice, there's a certain standard and a certain level of service that I think of. But when I go into other communities, I find that they don't have that. And that we are very blessed here to have Caldwell Hospice.
I'd like to just mention, not only working with the community providers as we do, we have branched out to have a greater connection with the hospitals. So we do consults within the hospital to try to help support patients so that they can get home with the additional support. We've branched to the oncology clinic as well, so that we're able to serve patients who are still seeking active cancer therapy as they should, that we would support them so that if there's a change, or, and I always say change because change could be dramatically improvement and healing, so even when the patient has changes, that we can help rally and support them in that. So we're going to look to go to other clinics, specialty clinics, to provide support.
And you've mentioned some, but I would like for you to talk to me about the range of diseases, serious conditions that you address, that you see in palliative care, just so if some of our viewers have, they've been diagnosed with something, they would know if maybe palliative care might be a fit for them.
So palliative care, of course, is designed for anyone with any serious illness. So serious illnesses could be COPD. Serious illnesses are congestive heart failure. Serious illnesses are any lung condition. Serious illnesses could be any kidney condition, renal failure, chronic kidney disease. Those are terms that you hear often. Palliative care can support patients that have liver conditions. So you hear patients talking about liver cirrhosis or hepatitis C or B or D. We've helped patients that have something called coronary artery disease, which has to do with the arteries surrounding your heart. We help patients with, I always say, anything you've got within these organs, we can help manage, some assistance with getting that taken care of. We work with patients that have cancer, any form of cancer, we can help support that. We have patients that have dementia. So I say, it's things of the mind, things of the body that we work on. So I think it's important to know that, is it just cancer that hospice or palliative care supports? Oh no, we work on every aspect of a serious illness that we can work with. I always say call. You never know what support we can provide for you. Our support could be symptom management, symptoms that may occur related to the disease, and we also work on the plan. As I say, we need to have a good plan. So those plans are say, hey, in the event that this therapy that you're currently getting, if at any point you think this is not what I want to do anymore, or this therapy is not effective for my treatment plan, is there anything else I could do? Well, yes, there's more we can always do. There's always something.
As you're talking about it, I think about all the patients that you're helping and what a delight you would be to come into a home, whether that's through telehealth or an actual visit, and just the comfort that you can provide. Thank you for that.
Thank you.
And I feel like I've left out a whole lot of questions because we've probably gone down some rabbit trails. Is there something we've missed?
I would say that I think it's important for the patient or family to call if they have questions. I always say call and we can help you navigate the system. The medical system is difficult. It's difficult. So if you could have a liaison or I always say let someone walk with you, have someone on your side to help you walk through a medical serious illness, we can do that. I always tell patients there are things that can be done, but is that the right thing for you at this time in your serious illness? We help patients, and particularly patients, have communication not only with their providers, but supporting them when they need to communicate with their family. I'll give you one more little quick point in case.
Yes.
I visited a gentleman a couple of weeks ago, and his family member is in Spain.
Oh.
And that's what I said.
Oh.
And so he said, oh no, but we've got this app. I can look them, we can talk to them on the phone if you want to. I'd like to do that. And so we called this patient's family member on the telephone, and they're in Spain, and I gave her good information about her loved one's current condition and the plan of care. She was elated.
As we talked, I've just thought as much about the family member and the support system, and by family I mean whoever that person, whoever is important to that individual, how much comfort you can provide for them, because sometimes when we have somebody that's seriously ill, you get so much information that you're confused. You don't know what to ask or what to do next. But to have a medical professional on your side, in your, right there with you to help you outline those questions, that is an amazing comfort.
It's rewarding. It is very rewarding.
Well, I'm just, thinking from the family member perspective, and I know for the patient, it has to be very comforting. Brittany, I know, what have we forgotten?
Well, I do. I have another a family testimonial about palliative care. We worked with a family recently who had a recent cancer diagnosis, and the patient's daughter was primarily helping with that care. It's pretty overwhelming to see the primary, to see different oncologists and look at different treatment options. So being able to have the palliative care provider come in and answer some of those questions and help start the conversation about advanced care planning, because that's a difficult conversation to have. So having someone who can kind of help coach a family through that was such a blessing. And then to help that particular patient ended up being served by our hospice program, and to kind of help walk along that journey with that family and help them make the decisions that were right for them and that were right for that patient's care. It was just a special thing to see, and to know that that caregiver had peace and had some support in the work that she was doing, because it was a totally new role for her. And then also to have some additional education and support and comfort and care for that patient, so that he would know what his options were and that he'll be able to ask the questions that he needed to ask. So it was a good thing to be a part of. So.
And before we close out, I just want to go back to the fact that you talked about the length of time that you work with a patient, that it could be a few days, a few weeks, or a few months, or years.
Yes.
And how do you determine that?
So the level of care is based upon the patient's needs and their medical condition. So we would traditionally visit the patient initially, one initial visit, make that determination of what our next steps are. So if we are helping them coordinate with other services, we'll add other support staff to help us get that done. We may see the patient on a once a month. We may see them on a once every 3 months. We may call them in 2 or 3 days to find out, did what we start benefit, or where do we go from there? We have patients that are in our program on a telephone call, just call and check in. So traditionally it's tailored based upon what the patient's needs are at that time.
And if a patient's needs change, can they call you?
Absolutely, they can call. If the patient's needs change at any time, they definitely can call in. And the palliative service is the same number for our hospice support. So it's 828-7 540-101, which is an easy number to
It's an easy
remember.
number.
And the other thing I do, particularly like with the family members of the patients, we leave literature in the home. Everyone traditionally has a cell phone, and so we put in our number into their cell phone. I don't usually put Freda by it, but I sometimes, but I would put Palliative AIM so that they know that, one, if we call you on your cell phone, that number will come up. Oh yes, that's not a robocall.
It's not a robocall. I should answer
I
this
should
call.
answer that call. And also that they would have that number readily available for them if they need to contact our services.
And you use the term AIM. Tell me what that means.
So AIM is labeled AIM as an acronym, and that stands for Advanced Illness Management. And that's what our service is a consult service to serve you with advanced illnesses that you may have or serious illnesses. We got away from it being just palliative in some aspect because that was a little more difficult to understand. What is that? What is palliative? But
it is a big word that can be a little confusing for folks. Ladies, do you have anything else to add? This is such a good conversation, but I don't want to keep you all afternoon because you probably have patients to see.
I'm actually off today.
Okay, wait a minute. She came in on her day off to talk to us.
I did.
Thank you.
Thank you.
And again, that just goes to show the level of care that you see at Caldwell Hospice and why we're so blessed here in this community.
We are, definitely.
We really are. Brittany, anything else?
No, just if you have a loved one who is dealing with serious illness, who feels like they could use some additional support, if you could use some additional education, reach out to us, and we can do an evaluation and see if there's anything that we can do to help you through those times. So.
Thank you, ladies, and thank you for the program that you provide and everything Caldwell Hospice does. We really appreciate it.
Well,
Thank
you
you
for having us, Paige. We appreciate you.
And thank you for watching Caldwell County Today.